Dr. Stephen Parodi is the Associate Executive Director of the Permanente Medical Group at Kaiser Permanente and joins me now from San Francisco. Doctor, thank you so much for being here with us. Many European countries have lifted or are in the process of lifting their restrictions, even though some still have high case counts. I mean, they're saying that the crisis is past and we have to start living with COVID. So when do you think the U.S. can sort of make that pivot towards dealing with it as an endemic disease? Are we there now?
Well, we're actually starting to see a waning of the Omicron surge, which is actually welcome news. Reductions in hospitalizations and actual reductions in overall infection rates. And I think what we can expect to see is that with this surge, we had a large number of people get infected, unfortunately. That being said, a number of people have developed immunity now, at least temporary immunity to the latest variant. In addition to that, we have a large number of the population that has been vaccinated, at least partially, and in many cases boosted. So with the combination of more immunity, the hope would be that over time, we're going to see less high surges and hopefully increasing amounts of immunity, which means that we do move into an endemic state.
You help oversee the care of some 4.5 million patients. Is there a danger that we rush, that we drop all the restrictions and then hospitals like yours are in danger of again being overwhelmed?
Well, it's a good question. And really, with the key point here is we want to be realistic. With other diseases like influenza, we don't just simply lift restrictions immediately. What we do is we take a measured approach. So when there's a lot of disease present, we take a lot of actions. We make sure that people isolate. We make sure that people, if they're exposed, quarantine themselves. And so we'll want to continue that sort of guidance, hopefully with actually a little bit more clarity.
One thing that might help soon enough, we should see all Americans of all ages able to get the vaccine. The FDA will now be looking at the data and will vote whether to authorize it for children under 5. So for you, what difference would that make in our quest to get back to normal? Because the asterisk here is that the vaccination rate falls as you get younger and younger down the age groups. And a recent Kaiser poll found that more than 2/3 of parents of children in that age group say they'll wait and see about vaccination or definitely not planning to vaccinate their young kids.
So first of all, I think is critically important. It's actually a game changer if we're able to vaccinate children that are aged between 6 months and 5 years. The reason being, since the start of the pandemic in the United States, 1.6 million children of that age group have been infected, and actually 287 of them have died. So just that alone tells me that it is critical that we get those youngest, most vulnerable of our population vaccinated. But secondly, just as importantly, is that it's going to allow us to more safely keep schools open because children in that age range are often siblings of children who are in school. And of course, they're children with parents, and parents are going to work. So if we want to be able to open up society more effectively, I think having those children vaccinated is going to be critical.
As we talk about getting back to normal, it does seem to depend not only on just where you live geographically, but what race you are. Black and brown Americans are still dying at a much higher rate than others in this country from COVID and are likely less likely to get some treatments like antivirals, for instance. So is there a danger that as we start sort of dismantling our emergency COVID response and drop the restrictions, that these groups will be disproportionately affected as all the protective infrastructure is dismantled?
Well, and it's going to be critically important that we have the right outreach mechanisms as we do open up society. So making sure that we still have actually the federal subsidies available so that people have access to testing, for example, that we have equal access to being able to get in and be seen. We are working with our state governments to ensure that there's equitable distribution of new therapeutics, whether they're monoclonal antibodies or the oral therapies. So we can't actually take our sort of eye off the ball, even if we are able to say, in fact, you don't need tests at a certain point in time, but you need to be able to have access to tests, perhaps if you're getting sick, for instance, and to provide that level of clarity that you may not need a test for surveillance, but you need a test when you actually develop symptoms.
And join me now.